Merkel warns that the country is still at the beginning of the COVID-19 crisis. We have more from our EBC Bureau Chief, Malu Francisco. Hello, Malu. Hi, Malu. Okay, I can hear. Can you hear me?
Yes.
Okay.
Yes, I can hear you very well.
Okay. Now I can hear you now. Okay, what are your updates for us, Malu?
Okay, here are the developments in Germany. Chancellor Angela Merkel warned that Germany is still at the beginning of the COVID-19 crisis. And she says we cannot return to life before the pandemic. Our everyday lives will be different. Merkel spoke today to the lower house of the German parliament, and she's urged the public to follow the restrictions in place. Showing German solidarity in this coronavirus crisis, the 16 federal states of Germany will enforce mandatory wearing of face masks as additional protection against the coronavirus. This begins on Monday next week. People must wear face masks when they enter shops or use public transport. Some states already initiated the mandatory wearing of face masks weeks ago, and every state may decide what kind of mask to wear. A medical mask is not required. Homemade cotton ones or even a simple scarf is sufficient. Regarding the latest COVID-19 figures from the Robert Koch Public Health Institute, new coronavirus cases in Germany rose by over 2,000, total number of infections nationwide at 148,046. And today, Alma marked the third consecutive day of rising infections. COVID deaths, as of today, a total of 5,094. One of the priorities in this fight against COVID-19 is to protect the healthcare workers. And Alma, we have with us from Bonn, Germany, one of the thousands of healthcare workers in Germany. And she's from Bonn. We have Luzelle Camarillo Montalvo, who works in a psychiatric clinic in Bonn, Germany. Hi, Luzelle.
Hi, Paul, Alma. Hello.
Please tell us a little bit about yourself.
Yes, I'm Lucille Montalvo. I'm working as a nurse, staff nurse here in Bonn, Germany, working in a safe ward, acute psychiatry, and I've been there for about 20 years now. And I'm living here at Bonn with my family. I have 2 kids, and my husband is working at home office.
Mm-hmm. All right, Luzelle, can you tell us, dumami ba ang cases, di ba psychiatric ward, dumami ba ang cases ngayon ng mental health cases because of the COVID-19 crisis?
Yes, Alma. Dumami po ang cases namin sa acute psychiatric ward, saying that the patients are suffering from depression, from schizophrenic, and bipolar disease, bipolar disturbances, and they are more anxious, stressed, and very disoriented, very unsure, uncertain po itong nangyayari sa kanila, and they don't have their daily routine like visiting the clinic at least once or twice a week, so they could have their routine consultation hours. So they are now in a hospital. We are admitting them as our patients in acute situations. So we need to handle and we need to be very aware of. And we should always orient them, advise the patients step by step what is really going on during COVID-19 pandemic.
Paano po yung step by step? How do you mean as step by step po?
So we admit po a patient. So first and foremost po, safety procedure. They would not hindi po nila sasaktan yung sarili nila.
Okay.
Hindi po sila kakaroon ng na tendency na they might bump their heads because of their hallucinations. Because under schizophrenic po, there are a lot of hallucinations po. They can hear something, imperative voices that they should hurt themselves. So we should handle it right away. We give medicines, maintenance on time, so they not hit or do things sa kasama po namin ward na staff or patients po nila. Marami po kasing cases na natatakot, so sasaktan po yung sarili. Pag nakakita po sila ng mga like knives or scissors, something like that po, madali pong mangyari na sasaktan nila yung sarili nila.
Oh my. So,
Yeah.
Malu,
Yes. Okay, I have a question for you, Lizelle.
Yes po, Malu.
Yung mga cases na gano'n, sa ngayon, no, because those are the regular residents that you have in your clinic, itong mga may kaso ngayon ng COVID-19, are they also from among the residents or are they from outside the clinic na in-accommodate ng inyong clinic?
Meron po kami, Ms. Malu, 2 patients po from the hospital, but they are geriatric patients. They are above 80 years old, and they're already suffering from chronic diseases like respiratory diseases, vascular diseases, etc. And the 3 of them are from outside po, which are also suffering from mental health. Yes po.
Yeah. Yes. Are visitors allowed?
No
Or
po.
no. Oh, no.
No,
Okay.
very strict, very strict. We're not allowed. We are only allowed, we will receive a phone call at first po from the info, from the entrance, from the personnel there, and then they will give an advice. Here are the parents of this patient. Can you kindly get some stuff or bag or personal things? We will just pick up it for our patients po, and then they will leave a small letter or messages or some card just to spirit them up, so they will get also not that sad and malungkot po kasi napakahirap.
Oh, another question, just a follow-up on that. Let's say, okay, the cases alone that you normally handle, that's quite challenging. And then adding the COVID-19 cases, so what comes to your mind? We want to hear your view, let's say, as a healthcare worker. So what comes to your mind when you go to the clinic every day? Yes, how do you help yourself so that you can have, let's say, all the strength that you need and the positive outlook so that you can continue caring for them?
Opo. I make this situate po, remind myself almost every day at least na what if mangyari po ito sa akin, yung empathy, very important po yun eh. Kung mangyari ito sa kaibigan ko, sa asawa, sa magulang ko, sa neighbors ko, sa friends ko, anong mararamdaman nila? So as a frontliner, as a healthcare worker po, ako po yung nagtatry na ma-maintain yung proper na communication para sa pasyente ko. Na maiwasan yung takot, maiwasan yung pangamba, magkaroon ng ma-educate ko yung patient ko. Through my experience, through my, after 20 years working there, so more or less po, alam ko na po yung handling with their bad experiences in life. Kasi marami din po kaming mga patients na using, substances like drugs and everything, personal problems, family problems, borderliner, etc. Yung empathy po na importante nun eh. Kapag po nandun na yung empathy, so madali mo nang marirelay ano yung nangyayari sa kanila. So they really need help. They really need support.
Okay. How do you keep yourself from being affected by all this?
Pray po. Pray. And my family, my friends, contact my family in the Philippines. And yeah, yes po.
So that brings change in your daily routine. And
Yes.
perhaps, yeah, and just before we let you go, what would be your message as a healthcare worker to the public so that the public can also help you in caring for your patients?
Um, Always be prepared po, be aware, and maiwasan po yung stigma sa mga mental health like depressions, like people are suffering with suicidal ideas. Maging aware po, matuto pong makinig, hindi po yung advice lang tayo ng advice, hindi naman po natin alam yung pinagdadaanan nila. Magkaroon po ng empathy, respect, and yeah, educate, try to listen more. Yun po.
Yeah. Oh, okay. Alma, do you have any further questions?
I believe she's into photography as well. I heard from Malu. Are you trying to divert yourself also from the atmosphere of the psychiatric ward? Away from that, what do you do outside?
During the lockdown period po, I had my short 1-week vacation. Ano po, baking. Nagtatry po mag-bake. And cooking, you know, and more singing with my husband, with my kids, with your karaoke po. Ganun lang po.
Okay.
All right.
And perhaps, Alma, in the future, we can invite her again because
Yes.
the people are saying because of the social distancing and the new normal way of doing things, you know, what change is doing to everyone. There is a kind of shock. This is something different. Yeah. Well, so we thank you so much, Luzelle, and we're looking forward to seeing you again, and we can talk about mental health care.
Yes.
Okay. Yeah.
Thank you very much po.
Thank you, Luzelle.
Thanks.
And thank you very much,
Yeah.
Malu, for this conversation. Thank you so much.
Yes, and Alma, just to turn to another development here in Germany,
Yes.
the German government here, and this is about employees, the employees and the business establishments, or especially the small business. The German government will implement a financial aid package for low-income workers and small businesses hard hit by the coronavirus pandemic. The plan aims to increase in stages the short-term benefits for furloughed workers, extend the duration of unemployment payouts, and provide tax relief to suffering industries like catering. So those are the developments as of now, and we'll continue to update our audience. Here in the Netherlands, Malu Francisco, we live in interesting times.
All right.